Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Welcome to the Feel Better, Feel Great podcast, episode 126. This is part of the organ performance improvement series, and today it's about bone health. I am Dr. Andrea McSwain. As we delve into the podcast, I want to remind you that while I am a medical professional, the information shared here is intended for education purposes only. It is not a substitute for medical advice. Please consult with your healthcare provider for guidance on your health needs. And let's talk today about bone health. When we look at bone health, first we have to understand, what is bone? It's a very important living, healthy tissue that has a lot of flexibility and adaptability. Of course, it gives us structure as part of the musculoskeletal system. So it protects our organs and helps us move. Okay, so alignment is really important. The other things is bones store minerals, and those minerals are much more than calcium and phosphorus, magnesium. The other thing, which I think a lot of people don't think about, is the bone marrow. So this is where blood cell production happens. So in the bone marrow, there are red blood cells, white blood cells, and platelets. And so we need really healthy bone in order to have really healthy blood. So what happens with bone? I think a lot of people think the bone is like a 2x4 that you have in your house. And when you put them up, then they stay up, and that's that. But that's not how bone works. Bone is constantly remodeling. So there are two kind of subcategories of bone cells, osteoblasts and osteoclasts. So the blasts are the makers and the clasts are the breaker downs. Bones are continually broken down and then new bone is built. And that is a very important natural process that needs to be facilitated in order to maintain bone integrity. Then also part of bone remodeling is the density. So usually the mass of the bone is reached in early adulthood, and then after that, the density of the bone will start to decline. But how quickly it declines is one thing. And also, where is the height of that peak is important. And then the fact that the bone is designed to recover through the osteoblast and the osteoclast remodeling system. So common bone health issues, there's really a few, and I think they get a little bit confused. So first of all, there's just a susceptibility. If you are a white, small-framed female, you have a higher risk of bone health. If you've had fractures, accidents, car accidents, scoliosis, anything bone-related, previous cancer, childhood cancers, you have a higher risk for bone health issues. Then we get into kind of like if you have kidney stones as a teenager, kidney problems, frailty in general, that's important. So if you know your bone density is low, then you're going to be really interested in, hopefully, in this conversation. So osteoporosis is weak, brittle bones with the increased risk of fractures. And also you see that diagnosis on the DEXA scan. That is osteoporosis. Osteopenia is a lower than normal bone density, but it's kind of a middle ground point. So first is kind of like looking for risk factors. Second is recognizing osteopenia, which means kind of low, and then osteoporosis, which is a problem and much more severe. When we test for bone health, there is a bone density test called a DEXA scan, and it is an X-ray. It measures bone density, and it can then diagnose osteopenia or osteoporosis by looking at different scores related to bones that are core bones. So lumbar, hip, those are the two main areas. There are some lifeline supports that people do, and they assess bone density in the wrists and I think the ankles maybe. Those are peripheral bones and not so important to things like hip fractures, right? Or even stress fractures in the thoracic area that are related to bone weakening and stress on the bone, which are compression fractures in the thoracic cavity. So then there's some blood tests people can evaluate. I really think vitamin D is just like the cat's meow on that. That you can test calcium, but calcium to me is not the end all be all when it comes to bone health. That's really important because it's a mineral complex in the bone. I think it's really important to remember. Also, as a side note, when we look at calcium intake, particularly from dairy, and we look at different cultures, the Japanese community, which has small framed people, have virtually no osteoporosis, at least in medical history. And the use of dairy is actually related to more fractures. So if you're thinking, I'll just drink more milk, actually think I'll drink less milk after this conversation, because that is not serving you. And the literature absolutely shows that dairy consumption is related to more fractures. The other thing is a lot of people dose with calcium and think, okay, I'll just dose my bones with calcium, but it's a mineral complex. The bone is a mineral complex. Bone health requires a mineral support system, not just calcium. The other thing with that is men don't usually have risk for fractures. So men taking calcium is very problematic in my opinion, because calcium doesn't just go to the bones. Calcium can also be stored in blood vessels and hardening of other tissues, organs throughout the body. So, definitely calcium specific and isolated calcium supplementation, in my opinion, is hazardous. When you look at D, you also need to be recognizing and working with a practitioner that understands how D facilitates calcium into the bones and doesn't just facilitate calcium absorption throughout the entire body, particularly in the blood vessels. Last thing we want is someone taking vitamin D and calcium and hardening their arteries. So definitely work with a qualified practitioner. Okay, then bone turnover marker, alk-phos. Alk-phosphatase has different subtypes. So if you're concerned about bone integrity and you see an abnormal result for alk-phos, then there are subtypes that you want to do. You don't want to just rely on alk-phos, because alk-phos is for the liver, and it's alkaline phosphatase is for the liver, the intestines, and the bone. So you want to test for those submarkers. All right, we discussed a little bit of imaging. Again, if you've had a fracture, you're going to be more susceptible to bone integrity issues, just because of how that plays out. Some people use the FRAX tool, which is a 10-year probability of major osteoporotic fracture. There are not a lot of people that use this, but I do think it's really important. I don't like when people just kind of wait it out and then they have a problem. The other thing is that adage that the people say I fell and broke my hip, but the truth is, in osteoporotic fractures, people break their hip and that makes them fall. Their hip breaks because they have such severe frailty in their bones and then causes the fall. That person's life expectancy is very short. So that is a different idea, and I really hope that sinks in, because I think it's really a game changer to understand that it isn't when someone falls and breaks their hip that it was the trauma of the fall that caused the fracture. It was actually the fracture that caused the fall. That's like when people step off a curb and have a significant problem with their bones. The bone was already compromised. I think that best plays out with a good friend of mine who was watching his young daughter was ice skating, and she fell, and he jumped over the railing to go help her, and he broke his leg because he had a bone tumor in the bone, a bone cancer, and that was the reason for the fracture. So the bone collapsed with the fracture, and he fell. He didn't fall and cause the bone fracture. Okay. It's an important paradigm shift. The other thing is now looking at conventional treatment approaches. So a lot of times people go to medications, particularly bisphosphonates. Now, bisphosphonates are supposed to slow down bone resorption, and the idea is they maintain or increase bone density. And what's really found is that they reduce the decline. That's not the same as helping the bone actually recover. Bisphosphonates do this, as it was explained to me by an osteoporosis specialist when I was a resident, is they help you add 2x4s. So they help with the bone building. Well, that does not necessarily help with the bone integrity, because the inherent system of the bone is to both build up the bones and break them down. And so by adding more 2x4s, you're not creating a better integrity, i.e. density, in the bones. The other thing with bisphosphonates, which I think is really important, is there is a 1% increased risk for the jaw bone dying. It's called jaw necrosis. That is 1%. That is 1 in every 100 people who take this medicine. And there are a lot of people that take this medicine. The other thing is that's for the general population. So when we had a wonderful patient of ours with ovarian cancer and mets to the bone and a very awful DEXA result showing osteoporosis, so very low bone density, when this lovely person came into the office and discussed that their primary care doctor wanted to put them on a bisphosphonate, I recommended otherwise. I recommended a bone mineral complex that has had amazing results for me in the clinic with an exceptional increase in bone density in a very short amount of time. She did make the decision to go on bisphosphonates to her patient autonomy. I respected her decision. About 6 months of her being on a bisphosphonate, I met her in the hallway to have her come into the room for the appointment, and I asked her how she was doing. And she said, "My teeth are falling out of my mouth." I had discussed with her the side effect concern of jaw necrosis at our original conversation on bisphosphonates. And when she put the two pieces together, that all of a sudden her teeth were falling out of her mouth, she stopped the bisphosphonates. We went to our physician level bone mineral complex supplementation, and she had a repeat DEXA scan at that point about 7 months later. So she found in the DEXA scan, she had about 7+% improvement in her bone density scan, even just within those 6 or 7 months that she had been using this mineral complex bone supplementation, as opposed to the bisphosphonates. She didn't lose any more teeth. She had a very large dental bill to recover from. And the other thing is, when she was having her repeat DEXA scan, the tech brought in the person who did it originally because they had so much bone density improvement. She wanted to verify it with her colleague. And this person has been using a bone density support that's based on a mineral complex ever since. And I think that's fantastic news. There are other medications that people use. I think that people talk about estrogen support, which is obviously very important, has to be done correctly. That includes hormone replacement therapy. I think that's one thing to think about, is how the medications work and just understanding that process, because I'm not a fan. And then, of course, lifestyle recommendations. So what are you eating? Good leafy greens, lots of things that have minerals, lots of, healthy fruits and vegetables. The other thing is muscle tone. So a lot of people say weight bearing. Well, does that include yoga? No, because it's not weight bearing. What about swimming? Doesn't include swimming. You need weight bearing, resistance, kind of pound the pavement to get that impact so that the bones can improve. Okay, and then fall prevention. This is important. A lot of times people will put in different things in their home for decorations. I remember doing a home visit once, and the husband was like 6'5", and the wife was like 5'1", and they had just moved into like a smaller home from what they had before, and she had this rooster statue that was around the corner after you walked away from the kitchen island. It was by the kitchen island. And it was such a trip hazard to him because, one, he wasn't in the kitchen very much, and two, he's like 6'5", so it's way outside of his peripheral vision. So these statues that are 1 to 3 feet tall, if you are moving into a new home, it's very important to recognize that you don't want to put in things that are going to distract your peripheral vision. And also, if there's a huge height discrepancy between you and your spouse, making sure that nobody falls is really important. The other thing, people use grab bars and proper lighting. I think that's really important. Balancing training is critical. So with my patients get into the summertime, I say, can you get on a kayak this year? Can you get in a canoe? And do it safely, obviously. So these are not my 80-year-old patients that I'm telling to get into a canoe necessarily. Some of my 80-year-old patients can get into canoes and they love it. But that's something we want to work on with balancing. The other thing is, when you stand up, do not lead with your neck or your eyes. A lot of times people will start like this. They'll start in this. When they're up, they're already turned their head. Now your balance organs in your inner ear need to stay level with the sight line. So this is not often said when you have conventional approaches, but it's related to fall prevention. So I'm going to talk about it for a second. The other thing is, when I've done home visits, like the person has their lazy boy facing this way, and then the bathroom is in the room behind them. So they have to do like 2 crook neck turns in order to get into the bathroom, and that makes them dizzy. So it's very important, when you are concerned about falls and when you are possibly moving into a new place to live as well, then in any case, that everything you position is going to help you be straight and go straight on when you go forward. Because if you're twisting your head, then you will fall. And I saw that over and over again, where people had to kind of hook a tight corner in their house, and they did it all the time. And they would turn their head because their body's a little more arthritic. When they move their head, their body would fall. And so you want your head to be on top of your body with your chin over your sternum. And for people who are really struggling with this from an alignment issue, you almost have to keep your hand on your sternum, breastbone, underneath your chin, so you recognize you're keeping your head in this direction. A lot of times the turning will mean that you fall. And this has helped so many people not fall. Very easy, it's a constant retraining. Okay. Then, as I've mentioned, so holistic treatment approaches. Okay. Clearly, it's nutrition support for the bone, right? So that's like the major thing. The bones need minerals, they need boron, critical, strontium, critical. And so there's a lot of mineral support that's specific for the bone, and depending on the level of severity, kind of means how much bone complex support do you need. There's kind of the basic one. People know they have a susceptibility because of their frame or because of injury, and they want to take a bone health support. I think that's great. And we have one called Bone Base, and that's fantastic. Then someone has osteopenia with no fracture on the DEXA scan. They want to look at, once a day, taking some supplements, optimal bone builder. Now, the third level is for people who have the diagnosis of osteoporosis. It is a important kind of physician level supplementation. And we have seen every single time that we have used it, 7 to 14% recovery within a year. A few years ago, DEXA scans changed from being available and covered by insurance from every 2 years to every 1 year if you have a problem. But a lot of providers are still offering DEXA scans every 2 years. If you're on a high-level supplementation, or if you do choose to use medications, then please work with your provider to have an annual DEXA scan until it improves. And then you go every other year or every 3 years, 5 years, 10 years, whatever, so that you maintain an awareness through imaging of what's going on in your bones. but you actually find the integrity and you can turn this ship around very quickly if you're doing these supplementation support. Clearly, there's a few other points here. One is the bones being part of the musculoskeletal system. If the muscles are weak, something called sarcopenia, weak muscles, goes along with osteopenia, weak bones. So you have to build the muscles, and the muscles need, like I said, that high impact or weight bearing activities for exercise, and the muscles also need to be fed. Now they like to be fed proteins, and I'll get into that. I've discussed it in another episode already. Sarcopenia is very significant. Occasionally with our patients, we will use a peptide therapy called sarcotropin. Sarco is muscle, tropin is build, where we get about a 19% muscle mass improvement. If you work with a provider who has the Emsculpt or the Emsculpt Neo, that's also excellent for building up muscles to improve those bones. So you have the strength in the muscles to support the bones. It's not the whole picture, but structure is really important. And to that point, as I've mentioned for fall prevention, but this is a little bit more holistic approach, which is looking at not just fall prevention, but actually, function follows form. So improve the form to improve the function of the bones. And definitely looking at reducing the hunch. The hunch starts earlier than people think. So the hunch is obviously where someone is very, 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 very rounded, right? But when does that rounding start? And I would suggest it probably starts in the late 30s, 40s, or for people who are bookworms or phone committed, that their sight line actually comes down sooner, and then their bones start to follow that with a rounding effect. So something to remain paramount and really concerned about is looking up and keeping your sight line high. When you look up, are you looking at the base molding, or are you looking at kind of the top of the world? And if you're looking at the top of the world, you're keeping your muscles long, you're keeping your bones decompressed, and that is allowing for you to have a lot more integrity in those tissues. So keeping your sight line high. Now, this is interesting because sight line goes down over time. And so when I work with my patients, I'm like, okay, where's your sight line? And I'm often kind of like pulling them up like a puppet string from their head. And it's like, okay, this is your sight line. So you have to really calibrate that as well in your home, because you're always looking at the same thing on the wall. In your car, you're always looking at the same thing, blah, blah, blah. So really look towards, where is my sight line? That is a paramount question. I think I've said paramount a lot in this podcast, because the point is your bones can get better. And it's really important because they hold you up and they're your outside support system, and you can do a lot to help them. And there's other things too, obviously, reducing stress and, breathing and stuff. All those things are general supports, but I just want you to know that bone health is definitely about improving the systems, improving the organs, and living a high quality of life. Not having where you shrunk or compressed, or being concerned that you're going to fall so you don't do so much in life and you reduce your activities. That's no fun. So thank you very much for your time today. I really appreciate the opportunity to present information on bone health as a way for you to feel better, feel great.